Operation of Ansen orthopedic casting tape and splint. The casting tape direction for use on upper limbs. Make sure to wear surgical gloves as a protection from glue. Use the protective padding or stockinette on the injured parts. Select the casting tape of proper size. Immerse the cast in room temperature water for 3 to 5 seconds and squeeze it 2 to 3 times. Take it out and squeeze out excess water. Repeat spirally on injured parts, overlapping the previous layer by 1/2 to 2/3 of the width of the roll. Keep proper tension. Excessive looseness will reduce the adhesion between layers. Excessive tightness will affect the blood circulation of injured parts. The whole operation is finished within 3 to 5 minutes, without any heating equipment, which not only eases the labor of doctors, but also saves the time of operation. Ansen cast is made of high-quality raw material with excellent air permeability and prevents skin from infection, aging, and smell. Well waterproof can resist 85% water penetration and keep the injured parts dry. When there is trauma on injured parts or long operation time needed, don't wet cast. Use it directly and spray water to its surface to fast hardness. When remove cast, just use the electric cast saw. The splint direction for use on upper limbs. Select the proper size of splint, immerse it in room temperature water for 4 to 6 seconds, and squeeze it 2 to 3 times. The curing speed is directly proportional to the water temperature. Take it out and squeeze out excess water. Cut splint to proper size according to injured parts. Apply to the needed parts and wrap by common bandage. Keep proper tension. Splint begins to solidify in 3 to 5 minutes, and it can bear weight after 10 minutes. The raw material of splint is MS cast, with excellent air permeability, water resistance, comfortable. Comparing with plaster bandage, the contractility of Ansen cast and splint is small after dry, won't make skin tight and itchy, and patients also won't feel burning and uncomfortable. Ansen cast and splint have excellent X-ray permissibility. Doctor can examine the healing of broken bones clearly and accurately without removing the casting and splint. The casting tape direction for used on lower limbs. Use the protective padding or stockinette on the injured parts. Use more cotton padding on the thin and bony parts if more strength needed. Immerse the proper size of cast in room temperature water for 3 to 5 seconds. Take it out and squeeze out excess water. Wrap it on injured parts. Take care to keep proper tension. Turn over the 2 ends of protective padding. Cutting off the extra parts. Bare the toes. Smooth and rub the surface to achieve good contact between layers. Operation will be finished in 3 to 5 minutes. It needs to be avoided excessive action within 5 minutes to be made the best stiffness before fully hardened. The solidified cast is high strength and light weight. Its strength is 20 times and heavier. Is only 1/5 than plaster product, which reduce the moving burden of patients and make them feel more comfortable. It's also easy to remove cast by using electric cast saw. The splint direction for use on lower limbs. Choose proper splint. Immerse it in room temperature water for 3 to 5 seconds. Take it out and squeeze out excess water. Use the splint to cover the fixed part. Wrap it by common bandage. Keep proper tension. Keep 5 minutes without moving before splint fully hardened. Various sizes of Ansen cast and splint will satisfy patients with different age and body type. Product display. Shanxi Ansen Medical Technology Development Company Limited. Address: Room A1003, Yalan Garden, Qingsun Road, Yinta District, Xi'an, Shanxi, China 710065. Telephone number +86 29 8525 6623. Fax number +86 29 85277 251. Email Ansen029@163.com. Email sales@xa-ansen.com. Website www.xa-ansen.com.